So number one being the community. It's important for me someday I'd like to work in like an urban underserved or rural underserved setting, to learn to work with patients who may be uninsured or underinsured, to do anti-racist work, to work closely with social workers, all of those things, to do community health work. And that's all a lot that North Memorial had to offer. What makes us special is that we work in North Minneapolis, which is a historically marginalized community, and that really shapes the learning that we're doing. Also, for me, being part of a diverse residency class was really important, to learn from all different residents who speak all different languages. I think we have another resident who speaks like 5 different languages, which is awesome. Residents of all different backgrounds, many of whom who represent the community that we work in, which is really awesome. And to be surrounded by faculty who are doing advocacy work and making space for that and having the important conversations. I want to do some addiction medicine work, knowing that I could do Suboxone at my visits. If you're really into sports med, they've got something for that. It kind of had a little bit of everything, but for me, the most important part was the community. One thing I've really enjoyed, so I'm in my second year right now, and in our second year we get to do a community health elective, which is super awesome. It's a whole month, and you get to do 2 ride-alongs in an ambulance. You get to go out with the community paramedics and see how they visit people's houses if they maybe have trouble accessing care, and check blood pressures. We do like clinic in the morning, and then in the afternoon we get to go to Avenues for Youth, which is youth experiencing homelessness, who are staying at Avenues for Youth, and we sit there and we do any like medical intakes and answer any questions. They might be like, hey, is it okay if I take ibuprofen with this medicine? And they just come by and say hi, which is really awesome. And then part of that, where we go to the Ladder, which is something that happens every second Saturday, where we work with kids in the community who are interested in working in healthcare, and that's like dedicated time that you get during that elective as well. So that's the most fun rotation, I would say. Other cool things that we get to do, I wasn't expecting this, but our program, one of our faculty is really involved with the rural community, so I got to go out to Wilmer last week and do some rotations out there, and I learned so much and got to do so many procedures, and it's really kind of inspired some interest for me in moving to a rural community and doing work out there, which I think is really awesome. We have a dedicated clinic that we get to do work in addiction medicine. We have faculty who are really supportive with that. If we have any questions, we can always go to him. So I did not think I was really an inpatient person coming into residency, but I really like the organization and the support that we have for our inpatient medicine. I feel like that time is really worthwhile. I learn a lot, and we're doing good care. I think we get a good baseline in everything, which is the most that you can ask for in a program. We get really good hospital medicine training. We get really good clinic training. For me, like I said, I really want to work in an underserved community, working with patients who maybe don't have great access to healthcare, and working through those barriers. And that's something that we're trained really well to do. If I want to go out into a rural practice someday, we can do, like I could spend a month out in a rural practice next year. I speak Spanish, and that's something I really want to integrate into my career. And on our labor and delivery floor, I actually get to speak a good amount of Spanish, a little bit less in clinic. But next year I'm planning to spend a month in Ecuador, which is going to be really exciting. So there's a little bit of everything. I'm thinking of just kind of getting right into work. I'm still deciding, what my next job will look like, but I'm thinking full spectrum family med, doing a little bit of everything. And that's really what calls me to work in a rural setting. You're able to do a little bit of everything, and especially like a rural community with a larger Spanish-speaking population would be really awesome. I don't get to choose exactly because me and my partner will both be looking for jobs, so we have to find a place where we can both find work. But that's kind of the vision. And I've always seen myself kind of in the long term working in a clinic at a federally qualified health center, kind of underserved setting. So in residency, you don't always do the same thing. Our rotations change every 2 weeks. So each 2-week block. Like whenever I'm on OB, it always looks the same. Whenever I'm on hospital medicine, it always looks the same. But each week it's always changing. But pretty reliably, the earliest you have to get to a rotation is 7 in the morning for the hospital-based rotations. And then the time that you finish, some rotations are like longer evenings, but then you have days off, or they're kind of like the finish around 5 or 6 o'clock. But I would say there's no predictable day. Like just last week I was in Wilmer, and now I'm at Children's, and before that I was on nights, so it changes quite often. But as someone who likes routine, you'll be okay. Go for it. I really like our program. I think the most special thing about our program is the people. I just feel like I genuinely can rely on my co-residents, and I can be very honest with them and trust them with everything, and that's probably the most important thing to me. So I would say it's a great community, and definitely come join us. And also there's like free food and free parking, which is important as well. So I'm a little bit boring because I'm from Minnesota, so I probably could quite enjoy living and learning on the beach. But this is where my family is from, and this is where I'll probably stay. But in all honesty, I think Minnesota is a really good place for family medicine. We have a bunch of really great programs here in Minnesota, a really big community, a really great, I would say, state healthcare system, and just a lot of support. So I really appreciate that. I appreciate being close to my family, so when life gets hard, they can bring me meals and look out for me. And then if you're like a very active person and you like to bike, there's that. If you want to pick up your cross-country skis or learn how to do that, you can do that. So there's a little bit of everything.